Good day, everyone, and welcome back to another episode of Amino Talk. I'm Mama Akil Hafiz, your host for today. Here at Amino Talks, we dive deep into the world of health science and also nutrition, breaking down complex topics into fun, engaging discussions. Today, we're tackling a very interesting topic: hypoallergenicity of amino acid based formula. With me, we have our sharp interviewer, Mama Irfan bin Zaidi, and a very special guest expert, Dr. Azam, who is a clinical dietitian specializing in pediatric allergies.
Awesome. So let's introduce our guest a little more. Dr. Muhammad Azam bin Muhammad Faisal has been working with children who have severe allergies for over 5 years, and they are very familiar with the word of specialized nutrition, especially amino acid based formulas. Now, for those who are new to the term, amino acid based formulas are often life changing for people with severe allergies. But we'll get into that in just a second.
Alright, to kick things off, Dr. Azam, could you explain to our listeners what exactly are amino acid based formulas?
Sure. So amino acid-based formulas are medical foods designed for individuals who cannot tolerate whole or partially broken down proteins. Instead of peptides, they contain individual amino acids, the building blocks of protein. Because they are so broken down, they are much less likely to trigger an allergic reaction.
Interesting. So that's where the term hypoallergenic comes in, right?
Yes, exactly. Hypoallergenic means these formulas are designed to be as unlikely as possible to cause an allergic response. They are so often used in infants and children who have conditions like severe cow's milk protein allergy, multiple food allergies, or eosinophilic esophagitis.
So for my first question, can a person have a reaction to an amino acid based hypoallergenic formula?
Yes, although it is rare, some individuals can still react to these formulas despite them being designed to minimize allergic responses.
So for my next question, what kind of symptoms might they experience?
Sy- Symptoms can range from mild to severe and may include skin rashes, vomiting, diarrhea, wheezing, or even anaphylaxis in extreme cases.
I see. So next question is, what should be done if the reaction occurs?
The formula should be stopped immediately. The mild symptoms may be treated with antihistamines, but signs of anaphylaxis require immediate emergency care and possibly an epinephrine injection.
And lastly, is an allergic reaction to amino acids themselves are common?
Hmm. Well, they are extremely rare. Most true allergy reactions are to proteins, not to individual amino acids. However, sensitivities or immune responses to other components in the formula can occur.
So Dr. Azam, why are amino acid based foods suitable for individuals with food allergies?
Good question. Amino acid-based foods are made up of individual amino acids, not whole proteins. Since allergic reactions are typically triggered by intact proteins or large protein fragments, these foods are ideal because they are broken down to the simplest forms, eliminating the immune response. This makes them safe for individuals with severe or multiple food allergies.
That's a helpful breakdown. Now, let's clear up a common term.
Yes, Dr. Azam, what does hypoallergenic actually means in the context of these foods?
Hypoallergenic means the product is designed to reduce the risk of allergic reactions. With amino acid based foods, There's no intact protein, so the chance of triggering an immune response is extremely low. These formulas are usually tested clinically to ensure they are safe even for the most sensitive individuals like infants with cow's milk protein allergy.
Very interesting. Let's talk about how these foods help in real life management.
Right, so how do amino acid based foods helps in managing food protein induced allergies?
For starters, they are essential for managing allergies like FPIES or eosinophilic esophagitis. These foods provide complete nutrition without any allergenic proteins that allows the body, especially in young children, to heal and grow, while also avoiding inflammation or allergic reactions. For some patients, it's the only safe and effective nutritional option.
To add more, how do amino acid based foods impact a child's overall development both physically and emotionally when used long term in allergy management?
That's a really important question because when we're talking about managing food allergies in children, especially severe or multiple allergies, we're not just talking about avoiding reactions. We're also talking about supporting healthy growth, development, and emotional well being over the long term. Amino acid based foods play a crucial role in all of those areas. From a physical standpoint, these formulas are designed to provide complete nutrition. They contain the essential amino acids, carbohydrates, fats, vitamins, and minerals that a child needs for proper growth. This is especially important for infants and toddlers who are in the most critical windows of development. Without a safe, nutritionally adequate alternative to traditional food sources like cow's milk or soy, many nutritionally adequate alternative to traditional food sources such as cow's milk or soy, many of these children will risk malnutrition or weight gain or developmental delays. We have seen in clinical studies that children who are placed on amino acid based formulas often show catch up growth if they have been previously underweight due to untreated food allergies. Their immune and digestive systems also tend to stabilize, reducing inflammation in the gut and allowing for better nutrition absorption. In conditions like eosinophilic esophagitis or FPIES, where the digestive tract is often inflamed, removing allergenic proteins and replacing them with amino acid based formulas allows the gut to heal and function properly. Now, on the emotional and psychological side, there's also a major impact, especially as children grow older and become more aware of their dietary restrictions. Living with multiple Living with multiple food allergies can be incredibly isolating for a child. They might feel different. They might feel different from their peers, especially at social events like birthday parties or school lunches. Having a safe, reliable food sources gives families peace of mind and can reduce anxiety significantly. In many cases, amino acid based formulas become the foundation of a child's diet when other foods are tolerated. This can help reduce the emotional stress of trying and failing with new foods, which often leads to fear and resistances around eating. For parents, it's a lifeline. It helps reduce the emotional burden of worrying and whether their child will have a reaction to every meal. With that said, long-term use also requires ongoing monitoring. Pediatricians and dietitians play a key role in making sure the child is growing appropriately and getting all the necessary nutrients. As the child gets older, we also start working with families to see if it's possible to gradually introduce safe foods, expanding the diet when medically appropriate, so the child doesn't have to rely entirely on formulas forever. So, in short, amino acid based foods are not just about managing an allergy. They are about protecting development, supporting emotional well-being, and giving families the tools to navigate a very complex medical and nutritional challenges.
Wow, that's so interesting. You know, when you say hypoallergenic, my mind jumps to skincare products. But this is way more crucial, right?
Totally. In this case, it's not just about comfort but survival. Some kids can tolerate even the smallest amount of intact protein.
Yeah, and I guess for a parent, seeing your child react badly to normal formula must be terrifying, right?
Well, absolutely. That's why these formulas are often a last resort when extensively hydrolyzed formulas fall. It's
Alright, for a deeper dive, I want to dig a little deeper. So, scientifically speaking, why are amino acid based formulas considered so safe?
That's a good question. The main reason is that amino acids are the smallest units of protein. When you break proteins down into individual amino acids, you eliminate the structures called epitopes that the immune system usually reacts to. Without epitopes, this immune system cannot recognize the protein as a threat.
That's like removing the enemy uniform before the immune system can even see them.
That's a really good analogy.
Are there any official standards to confirm if a formula is truly hypoallergenic?
Yes, there are strict guidelines. For example, to be labeled hypoallergenic, a formula must be tested in clinical trials and show that the 90% of the allergic individuals tolerate it without regulation. It show that 90% of allergic individuals tolerate it without reaction with a 95% confidence interval. It's a rigorous process, I would say.
Maybe you could share a real world example, like a case where switching to an amino acid based formula made a big difference.
Definitely. I had a case where a 6-month-old baby with a severe eczema and chronic diarrhea wasn't improving on extensively hydrolyzed formula. We switched her to an amino acid based formula, and within just 2 weeks, her skin cleared up dramatically and she started gaining weight normally again. It was a life changing experience for the family, I would say.
Wow, that's amazing. Sometimes it's easy to forget how much nutrition is tied to overall health.
Exactly. Good nutrition builds a strong immune system, supports growth, and reduces inflammation.
Okay, let's bust some myths real quick. The first one, amino acid formulas taste terrible. Is it true or false?
I would say that it is partially true, since they do taste a bit bitter compared to regular formulas, but kids usually get used to it, and the newer versions have improved flavors.
Okay, so for second myth, you can just switch back to normal milk after a few months. Is it true, doctor?
Mm, um, I would say there's a no, and it's false. It depends entirely on the patient's condition. Some kids outgrow their allergies, but others might need these formulas for years.
Oh, for the third one, amino acid based formulas are just a trend or what?
That is definitely false because these have been around for decades and they are grounded in solid medical science and not just trends.
Okay, so for the next part is challenges, cost, access, and awareness. So one thing I always hear is these formula are often expensive. Is that true, doctor?
Unfortunately, yes, they are significantly more costly than standard formulas, mainly because of the specialized production and testing involved in the process.
Oh, are there efforts to make them more accessible, doctor?
In some countries, they are significantly more costly than standard formulas, mainly, I'm sorry. In some countries, insurance covers them for diagnosed conditions. Advocacy groups are also pushing for better access and funding.
So I guess it's safe to say that awareness is a big part of it too. It's like knowing the option even exists.
Exactly. Many parents and even healthcare providers aren't fully aware, which is why discussions like this are so important.
Alright, time really flies when you're having a good conversation. Let's summarize what we've learned. So, amino acid based formulas are life saving for individuals with severe allergies. They are, they are truly hypoallergenic because they consist of individual amino acids without allergenic protein structures. Despite their cost, their benefits in improving quality of life are massive.
And busting myths along the way, seriously, it's an eye opening how much science goes into something as simple as water or formula.
My final message would be if you or someone you know struggles with severe allergies, do not lose hope. There are solutions, and amino acid based formulas are one of them. Reach out to healthcare professionals, get informed, and advocate for your needs.
Thank you so much, Dr. Azam. And to all of our listeners, if you learned something new today, share this episode with a friend or a family member. You never know who might need this information.
Thanks for tuning into Amino Talks. Until next time, stay healthy, stay informed, and stay awesome. Bye bye.
Bye.
Bye.